So just continuing this thread on the difference between psychosexual therapy and general psychotherapy, I want to just take a moment to talk about fertility-related themes. So there are specialist fertility counsellors, and they'll often be associated with fertility clinics to support people who are engaging in assisted conception for one reason or another. So that's a specialism within the range of general counselling. And general counsellors, particularly those who are qualified to work with couples, would also potentially work with themes of fertility, infertility, whether a couple wants to have a child or they want a child and they can't, and so on. So there's definitely space in general counselling and specialist fertility counselling for this theme. And again, quite predictably, what would the difference be for a psychosexual therapist? Well, a psychosexual therapist would have those knowledge bases that the general counsellors have, and at our school we cover the specialist counselling for fertility related themes as part of our module on working with fertility. But of course, a psychosexual therapist is also going to be thinking about the sexual impacts. So what does trying for a baby or not being able to have a baby or not wanting a child do in a couple's sexual relationship or their broader relationship? That would be the additional aspect that a psychosexual therapist will be able to bring to the work. So they'll be able to think about the whole general therapy themes of wanting children and not being able to have them, not wanting children and trying to prevent having them, and all of the different themes in between, and the specific sex and relationship impacts of those experiences, how it's affecting sexual interest and sexual performance, so-called.